Hello everyone, I'm glad to be with you today. Today we're going to discuss a very important parasite, and its importance is derived from that it is being a parasite very common in children. And this parasite, which we are going to study today, is called Enterobiasis vermicularis. Also, you can learn that this Enterobiasis vermicularis has a common name, which is called pinworm. As we go along in our lecture, we will know why is this parasite called the pinworm. As regards the geographical distribution of this parasite, it is very common, as we see in the red color, common in Africa, in Asia, in America. So we call this common parasite, we call it cosmopolitan, which means that it is all over the world. And it is the most commonly encountered nematode. The habitat of this worm, as we know, each worm has got a special place in the human body. So the habitat of this worm is in the large intestine of man, mainly children. And the part of the large intestine, which is the common site for Enterobias, is the cecum and the appendix. Both cecum and appendix are the common sites of Enterobiasis vermicularis in man, and especially in children. As we see in this diagram, the worms are studded and they are clustering in the intestinal mucosa of the large intestine. Morphologically, this worm is semi-transparent. As we will see now, it is semi-transparent. The cuticle is transversely striated. The male is always smaller than the female and has got a curved posterior end. The length of the worm, male worm, is from 2 to 5 millimeters, and it has got a single copulatory spicule. As regards the female, it is much longer. It is from 8 to 13 millimeter in length. It has a pointed posterior end and a double set of genitalia, a pre-equatorial valve. What is important in this worm, so that we can diagnose it as soon as we look in the microscope, is that the esophagus is double bulbed. Here we see this is the first bulb, the second bulb. The esophagus is double bulbed, which is a very important diagnostic morphological feature. The mouth has got 3 lips, and this we call the ale. The egg of Enterobias is very characteristic because, as we will see, it is asymmetrical in shape. These are mature when laid. That is why it is infective directly as soon as the person eats it or gets into the intestinal tract. It is infected. Enterobias, when laid, they are larvated, they are directly infected, and they are colorless. What is important is that they are asymmetrical. As we see here, they are ovoid but asymmetrical. One side is flat and the other side is convex. As regards the measurement, they are around 55 microns in length by 33 microns in breadth. So these are the characters, and of course we know that each egg we have to know the characters, the size, the shape, and the content. Here we see that how infection takes place. The route of infection is the infective stage, the mature eggs. These are if the person himself contaminates himself, so this is auto-infection. Once he scratches, then he will get infected and contaminating other hands or contaminating tablecloth, food and drink, underwear, bedclothes, floors, and even dust. When it is very compact, even dust in the room can contaminate the persons inside this room. This is another diagram showing how infection takes place in another diagram. Here, if this man is infected and he scratches his anus, his hand will get the eggs, which are directly infective, goes into the mouth. Once again, the cycle is repeated, and this is what we call auto-infection. If this hand of the child or a man infected contaminates another hand, this hand will infect himself, or this hand will infect another hand to infect himself. So we see how common and how quickly infection can take place through the infection with Enterobius vermicularis. Another life cycle, we see that if this man is infected, the eggs are found here, as we will see, around the anus. Scratching around the anus will make the eggs in the hands. The hands will contaminate the mouth, and the cycle is repeated. Once the egg enters the gastrointestinal tract of the person, it comes into the small intestine where the egg hatches, giving rise to larvae. These larvae move until they reach the large intestine where they mature. The maturation period takes around from 2 weeks to 2 months. Once they are mature, copulation between male and female takes place. The male, after copulation, dies and is expelled in the feces. The female generally moves until it reaches the posterior end in the anus, where it comes just out and to lay the eggs in the perianal folds, and then moves back again. From here we know that why is it called pinworm. It's pin as a pin. It irritates the part where it moves, so scratching takes place. This is why we call it pinworm. As a pin, it pricks, as a pin pricks your skin. So this is why it is called the pinworm. Here, as we said, after copulation, the male worms die and are expelled. The gravid females migrate down to the anus, especially at night. I forgot to tell you this, especially at night. They migrate to the anus, where they lay their eggs around in batches around the perianal region or the anal folds. Another diagram for the life cycle. Here, as we see, contamination, eating, goes to the intestine, hatches, goes to the large intestine, where the female moves and lays the eggs in this area, the perianal region or the anal folds. This is a point we have to just understand, is that the anterior end of the worm is attached to the intestinal mucosa, as we have seen previously. So this leads to mild inflammation and ulceration, giving rise to dysentery, as we will see. There is invasion of the superficial area of the mucosa, leading to granulomatous lesion, and here sometimes we can see eosinophils, sometimes, not always. Also, this worm can migrate to other areas. For example, it can reach the appendix, as you will see, and accordingly to where they are, they give rise to the manifestations, which is abdominal pain, sometimes fever, and abdominal discomfort, of course, because of the ulceration and inflammation. Also, there is digestive disorders, all this because of the inflammation and ulceration of the intestinal mucosa. There is digestive disorders, and if it happens to reach the appendix, it can lead to appendicitis. Of course, due to the inflammation and ulceration of the intestinal mucosa of the large intestine, it gives rise to dysentery. So dysentery is a main manifestation for Enterobiasis verbicularis. These are some diagrams showing how the Enterobius worm is attached to the intestinal mucosa. And this is a pathological section of the appendix. We said that the worm can have migratory effects. I can go to other places. For example, it can reach the urethra or the vagina. It can reach the uterus or the uterine tube, forming granulomas in these areas and also in the abdominal cavity. Migration of the female, it can migrate outside also of the anal opening. Accordingly, we can see eggs in the urine because it can migrate outside of the anal opening. So we can, eggs can contaminate urine, and we can see eggs in urine. So we don't get astonished if we see Enterobius eggs in the urine. These are contaminated from the outside. Or if it reaches the urethra, it can also contaminate urine. Due to the migratory effects to those areas, it can lead to urethritis, vaginitis, salpingitis, and vulvovaginitis. If we forget everything we have just said, accordingly, we have to remember that nocturnal perianal itching is an important symptom, and there is vulval pruritus, restlessness, and nervousness in this child. Because, of course, of the irritation, he becomes restless and nervous. Mothers come to the outpatient clinic. They just complain that her child is restless at night. He cannot sleep in a very peaceful state because he's always awakened, restless, nervous, scratching his anal region. This is because the female is laying the eggs outside the anal region. So if we forget everything about the clinical picture, we remember that it causes dysentery and there is nocturnal perianal itching with its consequences. Of course, the scratching in this area and the hands are not clean enough. This causes pyogenic lesions, abscesses, and so on and so forth. This is the anal region. As we see, these are the worms. They are about around the anal region in the anal folds, and this diagram shows a doctor or a technician trying to examine this area, and we will see how is it examined just in a few moments. To diagnose this case, of course, if a mother says that her child has got perianal itching, restlessness at night, without any other manifestations, we can easily diagnose the presence of Enterobiasis verticularis or pinworm in this child. So clinically, by history of nocturnal perianal itching, and we can detect adult worms by nocturnal examination of the area as we have seen here. What is this man doing? There is a special technique to examine the eggs, and this is taking a piece of Scotch tape you know, the scotch tape, cellophane tape, and putting it around the anus several times so that the eggs can adhere to this scotch tape.